Well, I'm really happy to introduce Becca Bamberg to our office. How long have you been here before this introduction?
A month now.
A month now. That's awesome. And we thought it'd be a great idea to do a little introduction on video, as well as she has a lot of amazing techniques, and I fail to have an ability to really articulate them as well as she does. So we're just going to conduct this as an introduction/interview. And plus the couches look like it's an interview kind of setting. And so we're just going to do it.
Let's
All
do
right.
it.
So we had talked earlier, obviously, you've been doing massage for 8 years.
I have this month.
And you have worked at as a spa setting as well as therapeutic medical.
I have.
But you were telling me that you like the medical therapeutic more to do. Yeah.
I do. I love seeing how people's journey goes as they're healing. And when they come in and I do an intake, I'll see where they are in that moment, and then we'll decipher which therapy is going to be best for them, or a mix of therapies. Sometimes it might be a blend of all of them, and it just comes out as we move. And then we just go from there, and it's always making sure that the client understands that the consent is theirs and they can change it at any point. So.
Okay. And then what are some things that you have what a lot of people would say a list of styles, but techniques. What are the main ones that you tend to kind of use that you're thinking of when you're interviewing a patient?
Most people come in understanding Swedish or deep tissue, which Swedish being relaxation with long strokes, and deep tissue with the intent of eliciting change from a specific muscle. So those might come into play, but then also cupping therapies. I use contemporary cupping. There's hot stone and cold stone and aromatherapy. Myofascial techniques might come into play, and it would be potentially a blend of all the above.
What's the myofascial aspect?
Myofascial is working with the fascia, so the connective tissue of the muscle. It's kind of like an orange, and you have the skin, and then you have that white pithy stuff. Well, that's the fascia. And then if you think of the sections as a muscle, and then the very center is the bones, that pith goes all the way through the muscles and all the way down into the bones, just like the fascia does.
Would people experience that as like it feels like a deep massage, or how would you describe it with that question?
It's more gentle, but it can elicit the same deep change that deep tissue can change, because it pulls on that fascia, kind of like saran wrap. You pull it off the roll, and it gets that little futsit in it, and it takes out the whole roll. It can be the same concept with fascia, in that it can get all wound up. You might have a snarl up in your abdomen, but you'll feel it down in your knee. And if we undo it up in the abdomen, the knee will release.
How do you find that location? Like if somebody says knee and you start to explore and you wind up somewhere, how do you go through that process?
Some of it's intuition, and some of it is you can actually feel through the body as it traces up.
That's really intriguing. And then the cupping, what is that?
So cupping is using a device that makes a negative suction. So it's a negative pressure instead of positive, which some people who don't tolerate a lot of pressure tolerate the cupping really well, because it's a lighter and it's negative. It's pulling on the tissue instead of pushing. And so I have both silicone and the hard plastic Kangzhou cups that use a mechanical device to pull the air out.
Okay. And it's putting a negative thing, but a lot of times is it also pulling fluids out? I've heard that's what it was used for as well.
It pulls fluids up into the lymphatic system.
Okay.
So it makes it more superficial. And that's the marking that you see. Some people refer to them as bruises, but they're referred to as marking, and that's the fluid and stagnant tissue being pulled up into the lymphatic level. Okay.
And why is that important?
Well, that frees up the muscles down below.
Okay. Glad I asked that question. So then you also brought up essential oils, which is something that lately I have been really looking into, and Becca's been working with essential oils for how many years?
25 years now.
Yeah, she made me a really nice one for stress, and it works so well. But I'm very interested in that, and how do you apply that with doing tissue work?
So I apply it diluted in massage oil. I'll have the client smell it first, because then they're getting the aroma. It goes up to the amygdala, which is the emotional center of the brain, and that starts eliciting change on the brain level, on the
Neuro.
psychological.
There you go.
On the brain level, on the mental level. And then it starts eliciting the change throughout the body. So it has both a physical and emotional aspect to it.
What about when you apply it to tissue? Is there a different dimension with that? You move from smelling into the amygdala and then on the tissue. Does it have qualities that affect it on that level as well?
It does. For example, peppermint. Peppermint's a vasodilator. It opens up the blood vessels and allows blood to flow. Where it's also, wake people up.
Mm-hmm.
If you have a cup of peppermint tea.
Right. Okay. Well, we did the pre-interview interview, of course, but I wanted to, something I just thought of is, you and I, Becca and I work on people, but we come from different paths, so we're still looking at the same person, but we see different things. And one of the things that really intrigued me with the pre-interview interview, which I just love saying, was how, and it's a conversation you and I have had earlier about, oceans of emotions, issues in the tissues, and but I like you. One of the things you mentioned is essential oils can actually touch with maybe some of the emotions that we have been through that maybe we couldn't have dealt with, or we just clenched in order to look like we weren't stressed, and it gets into the tissues. And a lot of times we were saying that can create why people come in. So how do you assess, or how do you go through that process of like, oh, I want to try this essential oil and I want to do this in the tissue, and what have you seen that no other way could provide? It's a big question.
One of my favorite blends, I call it muscle tension, and it has lavender and peppermint and rosemary and then black spruce.
Mm-hmm.
And that one, when I apply it, when somebody comes in and they just have this tension in their shoulders, when I apply it, it's like their muscles turn into butter. It's amazing.
I have to try that.
Right after your sniffer.
That's right. Yes. Awesome. And do you play with any other oils that you just love talking about, or kind of covered everything?
All of them.
Okay.
I have boxes and boxes of oils, because they just weren't cool 25 years ago.
No, they're cool now.
They're cool now.
They're so cool. I'm looking into them. So, how do you keep up with things like with your work, or like do you do some reading? What are some things that you are kind of contemplating?
I am contemplating going back for my certified aromatherapist.
Okay.
So get my aromatherapy certificate. So that might be the next step.
Awesome. And what is that? And why do you want to do it?
So that would be a year-long study on essential oils. It's not only the history of essential oils, but the botanical names of the essential oils, the uses of the oils, topically, aromatically,
Right.
internally. But internally is outside my scope,
Mhm.
but
Okay.
it's inside your scope.
Maybe. I'll have to check with my board. If not, we'll find someone to refer to.
Right?
Awesome. All right. Well, thank you for the interview.
Well, thank you.
And thank you for working here. Everybody's starting to really like her more than me, which is really, I'll have to deal with that later. But anyway, I just wanted to do the intro. Thank you for doing this. Thank you for filming. And we'll talk to you soon, Topic Tuesday for sure.